Good morning to all of you, to all those who make these daily broadcasts possible, and to Gisela. Excuse me while I remove my face mask. Like I was saying, to Gisela and to our colleague and signed language interpreter who accompanies us every day, and to everyone following us from different parts of the world. Today, we start the day with a high number of cases. Today, 326 people are hospitalized in Cuba. 11 are under observation. There are 169 suspected cases and 146 confirmed active cases. Quite a high number. In our primary healthcare system, 3,339 people continue to be monitored by our professionals and specialists, given the epidemiological situation in the country. Yesterday, over 3,000 samples were studied. 3,235, to be exact, were processed in our various molecular biology laboratories. 1,386 were processed at the Pedro Curie Tropical Medicine Institute, 565 in Havana's Hygiene, Epidemiology and Microbiology Center, 204 in Villa Claras, 194 in Santiago de Cubas, 508 in the Hermanos Almajeres Hospital Laboratory, 164 in the Genetic Engineering and Biotechnology Center Lab, and 214 in the Civil Defense Laboratories. Of the 3,235 samples processed, 33 tested positive for SARS-CoV-2 and COVID-19. This brings the total number of samples processed in the entire country thus far to 250,996, of which 2,588, or 1.01%, have tested positive for the virus. Yesterday, samples were processed from all of the country's provinces. 436 from Artemisa. The highest number, as is to be expected, was from Havana with 2,264, 69 from Cienfuegos, 127 from Las Tunas, 74 from Holguín, and 79 from Santiago de Cuba, as well as from other provinces. The 33 positive cases diagnosed yesterday are all Cubans. 24, or 72.7%, are confirmed case contacts. This brings the number of cases where the source of infection has been linked to a previously confirmed case to 2,228 people, or 87.5% of all cases. Of the 33 positive cases, 7 contracted the virus abroad. As such, to date, 196 people in Cuba, or 7.7% of all cases, contracted the virus abroad. As is customary, these people were isolated as soon as they arrived in the country. They were then tested, the results of which came back positive for 7 people yesterday. It has not been possible to determine the source of infection linked to 2 cases diagnosed yesterday, taking the number of cases where the source of infection remains unknown to 122, or 4.7% of all confirmed cases. Of the 33 positive cases yesterday, 14 are male, for 50.4% of all cases diagnosed in Cuba, while women represent 49.6%, after 19 of the 33 people diagnosed yesterday are female. 19 cases were asymptomatic, for a total of 1,425 people, representing 55.1% of all cases diagnosed to date. When we look at this group over the last 15 days, 75.8%, or 97 people, were asymptomatic at the time of testing, a very dangerous feature of the virus, as we can't know who is infected and who isn't. So, if we don't try to protect ourselves properly, the risk of infection increases. Of the 33 positive cases, 14 are between 41 and 59 years of age. 11 children or individuals under the age of 20 tested positive for the virus yesterday. 5 others are between 20 and 40 years of age, and 3 are over the age of 60. Of the 33 cases confirmed yesterday, 14 are from Havana, 13 are from Artemisa, 3 from Santiago de Cuba, 2 from Guantanamo, and 1 from Sancti Spiritus. Of the 14 cases from Havana, 1 is imported and therefore does not count toward the province's overall confirmed case rate, given that transmission did not occur in Cuba. The 13 local cases belong to Marianao, Plaza, Centro Habana, La Lisa, and 10 de Octubre. Artemisa has 13 cases, 12 from the municipality of Bauta and 1 from Caimito, all of which are linked to the recent outbreak in the province. Of the imported cases, 3 are from Santiago de Cuba, 2 are from Guantanamo, and there is 1 each from Sancti Spiritus and Havana. These are cases where the individual contracted the virus abroad. The 13 cases from Artemisa are all linked to the recent outbreak in the municipality of Bauta. Artemisa, therefore, has the highest confirmed case per 100,000 inhabitants rate over the last 15 days, standing at 12.24, higher than yesterday's. Villa Clara's rate remains unchanged at 0.13, and Cuba's rate rises from 0.95 to 1.14, given the number of local cases diagnosed yesterday. Following yesterday's diagnoses, of the 2,588 total confirmed cases to date, 146 are active hospitalized cases, of which 145, or 99.3%, are clinically stable. There have been no deaths to report in Cuba in the last 17 days, meaning that the island continues to register 87 COVID-19 fatalities since the pandemic began, for a mortality rate of 3.36%, which, compared with the regional rate of 3.87% and global rate of 3.97%, places Cuba in 21st position in the Americas and 113th in the world. As I always mention, 2 patients were previously evacuated at the start of the pandemic. Unfortunately, only 1 person was discharged from hospital yesterday from the province of Havana, a discrete number compared with the number of positive cases diagnosed yesterday. This brings patients who have recovered from the virus to 2,353, or 91% of all positive cases. One of the hospitalized patients is reported as critical but stable. They are from Havana and are being treated at the Dr. Luis Diaz Soto Military Hospital. The global outlook is complex. As of midnight last night, COVID-19 continues to be present in the same 185 countries. There are currently 16,465,707 confirmed COVID-19 cases worldwide, after 216,542 cases were diagnosed yesterday. 4,654 COVID-19 related deaths were reported yesterday. This brings total COVID-19 related fatalities to 653,862, for a global mortality rate of 3.97%. In the region of the Americas, which continues to be the epicenter of the pandemic, and Latin America especially given the situation in Brazil, there are 8,849,484 cases of COVID-19, representing 53.74% of all cases worldwide. Yesterday, 108,243 new cases were reported in the region. Yesterday, 2,775 people died of the virus in the Americas, for a total of 342,800 COVID-19 related fatalities in the region and a mortality rate of 3.87%. Regarding countries worst affected by the pandemic, the United States tops the list with over 4 million confirmed cases and over 148,000 fatalities. It's followed by Brazil with over 2,442,000 cases and 87,600 deaths. In third place is India with 1,483,156 cases and 33,425 fatalities. Then comes Russia, South Africa, Mexico, Peru, Chile, the United Kingdom, Iran and Spain in this order, out of countries with the highest number of cases and in some instances the highest number of deaths. This is the information we have on the behavior of the pandemic in Cuba and the world.